Good morning. With Memorial Day rapidly approaching, we're going to talk about tick removal today. The easiest thing is prevention, so when you're out, try to avoid tall grasses, wear long sleeves and long pants, and check for ticks every 24 hours. Make sure to look in all the places because they like to go into crevices. If you do find a tick, you're going to use sharp tweezers. Grab right at the head of the tick and you're going to pull up with a steady, even pressure. After that, you want to clean the area with alcohol. If it is a deer tick, you should call your doctor to discuss a preventive dose of antibiotics. Do not burn the tick, squeeze the tick, twist the tick, or cover it with any substance. A little bit of redness right at the site of the bite is normal. That's just your body's response to any bite. This is not the classic bullseye rash. The bullseye rash typically occurs 2 to 3 weeks after the bite. If you notice that, please call your doctor immediately, or if you notice fatigue, fever, chills, abdominal pain, or headache. To learn more about tick bites and removal, head over to my blog. You can click the link in my bio. And if you're looking for a doctor, click the link to learn more about Dr. Dilling Internal Medicine and Pediatrics. I provide high quality, comprehensive, and convenient primary care right here in New York City for people of all ages, from newborns to centenarians.